And now here's our reporter Laura Windsor with some important information.
Not long ago, a diagnosis of breast cancer meant the possibility of a very bleak future for the patient. The problem remains a serious one, but tremendous strides in the technology of early detection can literally save your life before you even know you're affected. We'll learn more during my conversation with Dr. Linda Bosserman of San Antonio Community Hospital in Upland, California.
Well, the Women's Center brings a long passion of many of us in the community at the hospital to have a center where women can come to get high-quality diagnostic services for breast disease and for bone abnormalities that are typical after menopause. There's three things that should trigger a woman coming for an evaluation at our center. One, if they find a lump in the breast at any age, they need to speak with their physician, have an exam, and that will usually lead to an ultrasound, possibly an MRI of the breast, or a mammogram, depending on the age. The second main trigger is if a physician finds an abnormality, or if there's a high-risk history in the family. Let's say your mother and sister and your grandmother had breast or ovary cancer. We would do earlier screening for those women. And the most common reason that one would come to our center would be for your routine annual screening mammogram over age 40. Age 40, we recommend a yearly mammogram for all women.
We asked Dr. Bosserman, how important is screening?
It's very important that we screen patients so that if there's any early cancer, we find it at its earliest stage. And screening has been the best way to find early lesions that have the highest chance of cure with the least treatments. When you go to have a diagnostic x-ray, you know you meet the front desk staff, you meet the technician. Behind our organization here are a lot of thoughtful community experts, our foundation, and the doctors, making sure that the equipment, the technology, the technique, the follow-up is a comprehensive care package for patients. It isn't just getting an x-ray.
We asked Dr. Bosserman, what are some of the myths surrounding breast cancer?
So one of the myths that I like to talk to patients about is that if there's a biopsy or a surgery on an area of cancer, that spreads the cancer, that the air touching it spreads the cancer. That is so not true. With our screening mammograms now and our diagnostic ability with mammogram and ultrasound, we can often do a small needle biopsy and find out a lesion is benign. Or if it's a cancer, we get all the information and the patient's in charge then of coordinating with the best surgeon and medical oncologist, radiation oncologist to have their best outcome. And there's no evidence that air spreads cancer. 5 years from now, our prevention is going to be better, and I think we'll keep finding earlier and earlier lesions. But I always like to tell patients, our best screening today won't pick up everybody. So we're working on more and more diagnostic techniques. Our center has the latest equipment, but that equipment is going to keep getting better, and hopefully we can find even earlier lesions. If we can do screening mammograms, and I tell patients this, if you hate doctors, please come early and do your screening, because if there is something, we find these lesions that are 1/4 of an inch or less, and they have 98 to 99% long-term cure rates. Let us help you.
Any woman is at risk of developing breast cancer, so it's imperative that all women get annual mammograms to detect breast cancer at its earliest stage. I'm Laura Windsor for the American Health Journal.